Good morning, all. I'm Dr. Reza Esfahani.
Hi, I'm Dr. Singh Palat.
I'm Dr. Esfahani, and Dr. Singh Palat is also with me. We are both medical directors. Number one, forgive me if I have my mask on and gloves. I'm at another facility. I'm sitting at the nursing station. So the two of us are getting together today to talk about the importance of vaccination. We thought it would be a good idea for us to get together and go over a few facts and basically tell you or let you know what our recommendations are and why we both feel strongly that the vaccination is important. We are very hopeful, and we are seeing the light at the end of the tunnel. So it is really good news, and we are here to share our knowledge and ask, or hopefully, provide you with some information and answer any question you might have.
First of all, you probably know that the vaccine is given in 2 injections that are given 21 to 28 days apart. We believe that full immunity doesn't happen until 1 to 2 weeks after the second injection.
We always stop and ask question, is this the right thing to do for ourselves? And is this the right thing to do for our residents? What are you hearing out in the community, and what do you recommend?
The 2 biggest concerns I usually hear about this vaccine are about its efficacy and its side effects. Efficacy means how well does the vaccine work? Well, the research going into these vaccines have met the highest scientific standards. 2 medical advisory boards have recommended that we authorize these vaccines. The boards oversee the development of the vaccine and scrutinize the scientific data. The scientists and physicians on those boards are separate from the government, and they're separate from politics. The current trials show that people who get the vaccine have a much lower chance of developing COVID-19. The people who get the vaccine also have a lower chance of developing severe cases of COVID-19. The FDA will generally approve vaccines that show at least 50% efficacy, while the current Moderna and Pfizer vaccines are reporting 95% efficacy. These vaccines work, and they work really well.
What I can tell you, whether it's flu or COVID vaccine, you are going to experience some difficulty afterward. It doesn't necessarily mean if you get the COVID vaccine, you're actually getting COVID. Just like when you get flu vaccine, it doesn't mean you're getting flu. What you are getting is flu-like symptoms. What you're getting is like COVID-like symptoms. Your body is reacting to something that is foreign, and in the process of this reaction, yes, you may have some low-grade fever, you may have some fatigue or what have you. And in fact, that is a good thing. That's when you know what you're doing is effective.
Fortunately, the vast majority of side effects are mild and last just 1 or 2 days. The most common side effects are pain at the injection site, fatigue, headache, and muscles and joint aches. And these are all signs that the body's immune system is being activated.
So if you happen to be someone with known history of severe allergy, whether it's through previous vaccination, whether it's through because of flu vaccine or other medications or what have you, you may want to stay away from this. Of course, we encourage you to talk with your physician that ultimately they know and you know your health history better than all of us.
The current vaccines that are available utilize mRNA technology. This delivery system has been used for many years in other medical treatments, and they are considered safe.
I have been following this and I keep reading on this. And from what I am seeing, at the end of the day, coronavirus, it's not a very difficult virus. It's a very simple virus. And we didn't have this kind of technology available to us 10, 20, 30, 50 years ago. Now we do. So that's why the vaccine, they were able to put this vaccine together so rapidly. In fact, one of my colleagues yesterday called and said, Dr. Esfahani, are you going to get the vaccine? Dr. Palat, are you going to get the vaccine?
I am eligible for the vaccine, and I plan to take it as soon as I can.
I am with you. I also feel strongly same way. I will get the vaccine as soon as it's offered to me.
I can't wait for the restrictions to be lifted, and I can't wait to stop worrying about this virus. The vaccine is part of the battle. The vaccine is what we've been waiting for to turn this pandemic around.
So at the end of the day, I'm going in with good faith. I have read about this over the last few months extensively, and I believe, yes, there is going to be some side effects, but the side effects, just like you said, are minimal. I'd much rather have a sore arm or not feel good for a few days and knowing that we can get through this pandemic and we can go on, take care of our patients and get on with business of living. As things come up, questions come up, please reach out to us. We are available. We are learning about this every day. Every week, something new comes on. So please reach out to us if you have additional question or concerns. With that said, be well and happy holidays.